My name is Mercy Feodor. I am a 400 level medical student. My group is going to be presenting management of acute poisoning. We are going to be presenting management of acute poisoning here at the outline. Talking about the definition of poison. A poison is defined as any substance, solid, liquid, or gaseous, which when administered in living body through any route, inhalation, ingestion, surface absorption, will produce ill or death by its action, which is due to its physical, chemical, or physiological properties. Talking about the definition, we are all familiar with what poison is, and this just explains to us ways in which it can get into our body through inhalation, ingestion, surface absorption, and so on. I'm going to be talking about classification of poison. Poison classification can be based on various criteria. We have based on the origin, based on the mode of action, and based on the systems it affects. Talking about the classification based on origin, we have natural poisons, and from the word natural, we understand what it means. That it is not artificially made or synthetically produced. So, talking about natural poisons, we have plant toxins, and examples include um, alkaloids. And alkaloids are nitrogen-containing compounds that are very potent. We have examples. We have morphine. We have atropines. We have glycosides. They are compounds that use on a more sugar on hydrolysis. And we have examples of digoxin. And we have lectins. They are proteins that bind to carbohydrates. And we have an example as glucines. We have animal toxins and toxic substances that are actively derived through bites or any other mechanisms. We are familiar with venoms from snake. And when anyone has a snake bite, it releases its venom into such person. And we have other venoms. We have cobra venom. We have bee venom. Talking about animal toxins still. There are some kind of animals that have their toxins on their bodies, and when you touch them, they can harm. An example is poison dart frog and so on. We have microbial toxins, still under examples of natural poisons produced by bacteria, fungi, and other microorganisms. An example is botulinum toxins, which causes botulism. An example or the manifestations of this botulism include muscle contraction, respiratory failure, and potentially death. Now, going to synthetic poisons, we have industrial chemicals such as cyanides, heavy metals such as lead, mercury, and solvents, e.g., benzene. We have pharmaceuticals, overdose or misuse of drugs, e.g., opioids, benzodiazepines, and paracetamol. Um, Paracelsus, a Swiss physician, gave this quote that all things are poison and nothing is without poison. Only the dose makes a thing not poison. That's to explain to us that the toxicity of a substance is dependent on its dose. So, talking about these pharmaceuticals, the fact that something has a therapeutic purpose does not mean it cannot be harmful. It only depends on the dose or how it is taken. So we have pesticides, such as insecticides, herbicides, and rodenticides, e.g., organophosphate. Okay, talking about the other classification based on the mode of action, we have corrosive poisons. They cause tissue damage upon contact. So when anyone comes in contact with it, it can cause tissue damage. An example is acid, and we are all familiar with acids and how they work. We have asphyxiant poisons. They disrupt oxygen supply or utilization. And examples are carbon monoxide or cyanide. We have neurotoxins. Neurotoxins, from the word neuro, they affect the nervous system. And examples are organophosphate, lead, botulinum toxin. We have hepatotoxins, from the word hepatocyte, they damage the liver. An example paracetamol. Like I explained the other time, that the toxicity of a substance if you need those. So overdose of paracetamol can affect the liver. Amanita phalloids, and that's the mushroom toxin. We have nephrotoxins that affect the kidney. Examples are ethylene glycol, heavy metals such as mercury. We have hematotoxins that affect the blood or hematopoietic system, and examples are benzene or arsenic. Now, I want to talk about based on the systems they affect. They can affect the central nervous system. So, central nervous system poison. And examples are depressants, alcohol, opioid, and benzodiazepine. Stimulants, we have cocaine and amphetamines. Then, the ones that affect cardiovascular system, we have the ones that affect heart rate, rhythm, or blood pressure. Examples of abuse of digoxin, beta blockers, and calcium channel blockers.
Next person, introduce yourself, right? Good morning, everyone. Good morning, everyone. I'll be talking. Good morning, everyone. I'll be talking on the general symptoms of acute poisoning. So, symptoms, we all understand what symptoms mean. That is the manifestations that the patient himself or herself would see when this happens. So, firstly, there can be vomiting, diarrhea, upper abdominal pain, jaundice, difficulty in breathing, palpitations, skin rashes, scanty urine or low urine output. So the general signs are what we would see as a physician when we are examining this kind of patient. So firstly, we can see fever, vomiting, diarrhea, dehydration, jaundice, discoloration of the tongue, unusual fetor, changes in breathing rates or irregularity in breathing, changes in pulse rate or irregularity in the pulse rate, skin lesions, abdominal tenderness, then change in the pupil size. So there's something we call danger sign. That is, this thing. What are things that as a physician when you see, you know that okay, it's a high risk patient. So when there are no breathing or there's wheezy or noisy breathing, or when the pulse rate is below 50 or above 110 beats per minute, when the pupils are non-reacting to light, or where there is loss of consciousness, when there is continuous seizures, or like I said earlier on, fever, temperature that is higher than 39 degrees Celsius, or severe abdominal tenderness, anuria. So anuria is low urine output as well, and hysteresis.
I'll be talking about the management of a poisoning patient. Management of a poisoning patient is a critical aspect of emergency medicine. Timely and effective intervention can significantly reduce morbidity and mortality associated with poisoning. The key word here is going to be timely and effective intervention. If the person is not presented early to the hospital or there are not immediate interventions after someone is poisoned, it increases the rate of morbidity and mortality. This presentation This presentation covers the systemic approach to managing a poison patient, including the initial assessment, stabilization, diagnosis, treatment, and supportive care. I'll be taking the part of initial assessment and stabilization. Initial assessment and stabilization. We are going to approach it with firstly, we are going to resuscitate the patient. And we know the ABCD of resuscitation. We must make sure that the airway is clear, ensure that the airway is open and clear, look for signs of airway obstruction, consider the need for intubation if the patient is unconscious or has a compromised airway. Just like how they previously mentioned that there are danger signs. If the patient is not breathing at all, you have to do everything possible, or you have to consider intubation if there are no signs of breathing. Be breathing. Assess respiratory rate, effort, and oxygen saturation. Provide supplemental oxygen if needed. Be prepared for advanced airway management if respiratory failure is imminent. So what we understand that any oxygen saturation below that of I think 96 should be considered for intubation. C. Circulation. Check pulse, blood pressure, and capillary refill time. If the pulse, if the pulse is less than 60, is a danger sign. They should check the blood pressure also. Any blood pressure less than 90 for the systolic and 60 for the diastolic should be a sign that the person needs help. And capillary refill time. Establish IV access. Administer IV fluids for hypotension. Consider vasopressors if fluid resuscitation is inadequate. Disability. D. Assess neurological status using the Glasgow Coma scale. We all understand what Glasgow Coma scale and the scoring system. You will read it by yourself. Look for signs signs of altered mental status or seizures. Manage seizures promptly with benzodiazepines. We understand that benzodiazepine is an anxiolytic, which is going to help to reduce the signs and symptoms. Exposure. Fully expose the patient to look for any signs of poisoning, dingy skin changes, track marks, odors. For for um, for corrosive agent that is poured on the skin, there's definitely going to be skin change. So this is necessary for you to be able to assess every part of the patient. Some parts may not be open to you if you are just going to look at the person at the face value only, but you have to explore every part of the patient. Control the environment to prevent hypothermia. Hypothermia is going to reduce the rate of metabolism if you are administering a drug for the patient. It's not going to work effectively. We are moving to secondary survey now. After the initial assessment of resuscitation, we move to secondary survey, which includes taking a proper detailed history from the patient. If the patient is unconscious, you can ask the family or witness if possible. Identify the substance. The things that are very key in this history is identification of the substance, the dosage, just like how they previously mentioned, that it's not just about that the quantity of like anything can be a poison, but it's just the amount that determines how much the person is going to react to it. Time of ingestion and route of exposure. For the physical examination, we are going to perform a thorough examination focusing on specific signs of poisoning, e.g. pupil size, skin color, and breath odor. For organophosphate, you can easily detect from the breath odor of the person that this person has ingested something. And skin color for corrosive bonds, pupil size for people that probably on stimulants that they are reacting to it. Investigations. Other appropriate laboratory tests, e.g.
And still under secondary survey, you have investigations, other appropriate laboratory tests, e.g., blood gases, electrolytes, renal and liver function tests. Perform toxicology screens if indicated. Toxicology screens helps to determine if there is presence of toxins in the body. Obtain imaging studies if trauma or other complications are suspected. Imaging studies like chest X-ray, abdominal X-ray, or CT scans can be used. Under laboratory tests, we have the blood test. For complete blood count, it can be used to check the overall health status of the patient. And then the electrolytes, to check if there is electrolyte imbalance. The liver function test, to check the hepatic function and if there is liver damage. The renal function test, and the arterial blood gases. Arterial blood gases are used to check for the level of oxygen and carbon dioxide in the blood. And if there is, and to check the pH level, if there is imbalance of the acid base. Toxicology screen. There are specific tests for suspected toxins, including blood and urine toxicology screens. And we have electrocardiogram to identify cardiac abnormalities such as arrhythmias that may result from poisoning. Imaging studies. We have X-rays, CT scans, or ultrasounds if internal injuries or foreign bodies are suspected. So these are the other diagnostic procedures. Serum levels. To measure the serum levels of specific toxins, such as acetaminophen, salicylates, or glucosine, to guide the treatment. So for the urine test, analyze urine for toxins, metabolites, and other indicators of poisoning. Urine tests can also give an insight on the renal function. Radiographic imaging. Use imaging to detect ingested foreign bodies, aspiration, or damage to the organs. As I said earlier, you can use radiographic like the X-ray, CT scan, and the
In continuation, I'll be taking the treatment. So, in treatment of poison, we need to identify the toxin. We need to decontaminate and we need to support the care. So identification of the toxin, clinical clues, consider the patient's symptoms and physical signs, e.g. salivation, lacrimation, urination, defecation. Toxicology testing, use laboratory tests to confirm the presence of specific toxins, interpret results in the context of clinical findings. So your clinical findings and your result interpretation must go in line together. And decontamination is removal of harmful agents from the body. So, and these are the ways you can decontaminate poison. First, by gastrointestinal decontamination, activated charcoal is being used in this case. Administer within 1 hour of ingestion for certain toxins. Activated charcoal is to prevent absorption of toxin, and so it's best used within 1 hour. So it reduces, its effect reduces with time. Dose 1 gram per kg in children, 50 to 100 gram in adults. Contraindications, compromised airway, risk of aspiration. So when there are this, we don't give activated charcoal. Gastric lavage. Lavage simply means that you irrigate the gastric and the stomach. So consider for life-threatening ingestions within 1 hour, requires protected airway and experienced personnel. So experienced personnel is very important in gastric lavage. Whole bowel irrigation, useful for sustained release or enteric coated drugs, iron and packets of drugs, use polyethylene glycol electrolyte solution. So, and the purpose of using polyethylene glycol electrolyte solution, it helps in it helps to maintain electrolyte balance, because at the process of irrigation of the bowel or the stomach, there might be electrolyte imbalance. So this helps in that. Dermal and ocular decontamination. So the toxin can be present in the skin, can be present in the eyes. So for the skin, you remove contaminated clothing, wash skin with soap and water. Eyes irrigate with copious amount of saline or water. Continue until pH normalizes and symptoms resolve. Antidotes. There are some specific antidotes for some specific overdose of drug and toxin or poison. The first one is naloxone for opioid overdose, atropine and pralidoxine,
Pralidoxin.
pralidoxine, pralidoxine for organophosphate poisoning, N-acetylcysteine for
N-acetylcysteine.
N-acetylcysteine for acetaminophen toxicity, flumazenil for benzodiazepine overdose, use with caution. Digoxin specific antibody fragments for digoxin toxicity. Enhanced elimination, hemodialysis can also be used. It helps in facilitating elimination of all this poison. Consider for severe poisoning with substances like methanol. Methanol has metabolites that are harmful to the body, and so hemodialysis helps in facilitating the removal of all these metabolites. Ethylene glycol salicylate or lithium. Urinary alkalinization, used for poisoning with weak acids like salicylate and phenobarbital. Administer sodium bicarbonate. So supportive care, monitoring and support, vital signs, you need to monitor the vital signs. Electrolyte balance, you need to check if the electrolytes are in good shape. Organ support, support for respiratory and renal failure if necessary. Symptomatic treatment, seizures, manage with benzodiazepines. If there is arrhythmia, treat according to advanced cardiac life support ACLS guidelines. Hypertension, use IV fluids and vasopressors if needed. Thank you.
Good morning. I'll be talking about management of specific types of poison.
Good morning, folks.
we have carbon monoxide poisoning. Carbon monoxide poisoning may occur as a result of industrial or household incidents or attempted suicide. The pathophysiology behind it is that carbon monoxide binds to hemoglobin, and it does not allow oxygen to bind to it. And carbon monoxide um, has hemoglobin has higher affinity for carbon monoxide more than oxygen. So there's tendency for it to bind to oxygen, for it to bind to hemoglobin more than oxygen.